This is also called a silent killer, as it is responsible for brain strokes, heart attacks, and kidney failures that can lead to an early death. There are 1.28 billion people between the age of 30 to 79 suffer from this deadly disease. Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Mohammed Ilyas. He's acute medicine consultant. Welcome, Dr. Ilyas, to Faith and Discipline podcast.
Thank you very much. Thank you for giving me the opportunity.
I have the guests. They come from different specialties and backgrounds like cardiology, rheumatology, or gastroenterology. What is acute medicine?
Yeah, so acute medicine, we deal with the adult patients presenting with acute medical emergencies, which could be emergencies related to various other medical problems like diabetes, it could be respiratory problems, it could be gastrointestinal problems, or cardiovascular problems.
Right, okay. We hear a lot about blood pressure to be high, blood pressure to be low. What is blood pressure and why it matters?
So blood pressure, I will break it down into two parts. Is basically, one is what is blood pressure? You asked the question. Very important. Blood pressure is basically the pressure exerted by the blood on the walls of blood vessels. So when our heart pumps the blood to go through all the body, it creates a pressure within the blood vessels, and that is measured as a blood pressure. Why it matters? It is very important risk factor for various kind of health problems. And in particular, I could say that it is third most common cause of causing health problems in UK. After smoking, poor diet, blood pressure comes the next as one of the main risk factor for causing health issues.
Okay. So blood pressure can be high or it can be low. Let's discuss the hypertension first. What are the complications of hypertension?
So blood pressure there are two main kind of, or you can say classify the two main kind of problems associated with the blood pressure. One, when it is too high, and the other one, when it is low. When it is too high, we call it hypertension. And when it is too low, it is called hypotension. Hypertension is a more common problem. Hypotension is a relatively less common, but it's also a very important problem. So if you go by the definition, the hypertension, generally speaking, we say the person has got high blood pressure if the blood pressure readings are high for their given age, for given gender. So generally speaking, 140/90 is considered as a kind of cutoff point. Any blood pressure higher than that, we usually will classify them as hypertension.
What are the complications of hypertension?
So hypotension is a condition where you have a blood pressure which is low. And then, as I mentioned earlier, the blood pressure is basically the pressure exerted by the blood on the blood vessel wall. And it has two parts. When the heart is pumping the blood, that pressure exerted on the blood vessel is called systolic blood pressure. And when actually the heart relaxes, the pressure within the blood vessel is called diastolic. So generally speaking, 120/80 is considered as a normal blood pressure, or anything less than that.
120 is systolic and 80 is diastolic.
And something between 120 as a systolic to 90, and diastolic between 60 to 80. That is considered as within a normal range. But again, it can vary depending upon the age. Low blood pressure usually will cause symptoms, and most common symptoms patients may have, they are like, they may feel dizzy, they may feel lightheaded, they can feel very tired, and they can collapse and have falls. And this is something which we as acute physicians see every day in emergency departments, especially in elderly group patients who come in with a low blood pressure. They felt dizzy when they tried to stand up from sitting position or get out of the bed, and as a result of it, they had a fall because their blood pressure dropped quickly. And when the blood pressure dropped quickly, they obviously can't carry the oxygen around to the brain to function properly, and they can have a fall, which can sometimes lead to injuries.
And the injury can be serious and life-threatening as well.
It could be potentially very life-threatening and serious. Sometimes the most common things which we see, especially in elderly group patient, is that when they have a fall, they can break their bones, and that can be very serious.
That's quite sad. So is hypertension considered a serious health condition that needs urgent attention, or is it just easily manageable?
So it depends upon situation, but usually, as I said, hypotension or low blood pressure is a consequence of something happening.
Okay.
And majority of the cases we deal in our emergency department is usually related to either loss of volume, which is like loss of fluid from the body, like diarrhea, vomiting, bleeding, and sometimes it could be a side effect of the medications you're taking. Okay. So the patient are appropriately taking blood pressure tablets because they are known to have high blood pressure. But because if some certain change in the health condition, like they have infection, like they started vomiting, but they also took the blood pressure tablet, which as a result of it causes the blood pressure to drop more.
Okay, right. How can we manage it? Is there any way we can prevent it?
Yes, so there are things which we do, for example, when we deal with such patient coming to emergency department, we go through the list of their medications to find out are they on any medications which is contributing for them to have a low blood pressure. Then there are certain health conditions like diabetes, which over a period of time causes damage to the nerves which control blood pressure, and those patients are more prone to have low blood pressure. Parkinson's disease patient can be more prone to have low blood pressure, especially when they change their posture and positions. And the other things which we go through, find out what could be the contributing cause, like an infection, if they have diarrhea, if they're vomiting. So the main treatment depends upon the underlying cause. Okay. And it may also mean we may have to adjust their medications they're taking. It may also mean we may have to advise them regarding their lifestyle and diet. They may have to drink more water than usual in order to maintain their fluid balance. And similarly, the one good advice which could be very helpful is that those patients who fall into this type of category, elderly patients with history of diabetes, Parkinson's disease, or those who are on a few blood pressure medications, especially above 65 years age, we advise them to change their posture and position in a staged manner. Okay. Which means they should take their time to change their position from sitting or lying in order to stand up. Okay. So first, from lying position, sit on the edge of the bed or the chair, allow your body to adjust to the change in the position, and then stand up. And that could be a very useful tip in order to prevent the complications due to sudden fall in the blood pressure.
So due to hypertension, people might have blackouts.
Yeah.
And low level of hemoglobin in the blood, we call iron levels. So some people suffer from that. When it happens, that episode, does it cause hypertension?
It sometimes can cause. Anemia is also, we call it anemia, which could be one of the cause of the anemia is iron deficiency as well. So anemia could be a contributing cause. When patients have anemia, they obviously have low blood volume. And the other hand, even if they not have a low blood volume due to blood loss, the hemoglobin carries the oxygen around. So if they have anemia, their ability of blood to carry the oxygen around also becomes low. So when there is a sudden drop in the blood pressure, the patients can have falls, they can pass out, which we call syncope in medical term.
Yeah, syncope. Right. Okay. I believe syncope can happen due to heart problems as well, some angina and syncope. Right. So if someone is having, for our viewers, if someone is having an acute episode of hypertension, they're having they feel like they're having a blackout or something, what they need to do to bring their blood pressure back to normal, because it can be quite scary for somebody.
Exactly, it can be, and we do see these type of cases in emergency departments. Sometimes, as I said, it could be situational, and sometimes it could be related to underlying cause. So sudden, for example, situational could be a sudden unexpected news. So you might have seen or come across a situation where people pass out on some either a very good news or very bad news that affects the heart, which results in sudden drop in the heart rate and the blood pressure, and people can pass out. So one advice we give them is that if they feel like these symptoms are coming up, like if they start feeling lightheaded, dizzy, I would advise in that if they are standing up in that, feeling those symptoms, try to break your posture. Sit down or lie down, depending upon where you are. So if you have access to somewhere where you can lie down, do that. That will help to normalize the blood pressure by improving the flow of the blood to the brain and prevent you from having any injuries or falls. And then the other thing which, as I said, which can be helpful is the improving fluid intake. What we advise these patients is to make sure they're drinking at least 2 liters of water to up to the lunchtime. Or the simplest guide is your urine color should be similar to water color. That is a good indication of hydration in the body. Okay. Thirdly, which could be important, is if you're having these symptoms, is maybe you need to have a consultation with your GP regarding the review of your medication. Okay. Maybe the medication you're taking are overdoing. So you may have to cut down those medication. Sometimes just simply changing the timings of medication could be helpful. Okay. For example, if you're taking blood pressure tablets in the morning and you mostly feel these dizzy symptoms during the daytime, it may be wise to change the timing from morning to evening time when you are not up and about.
Okay, that's a really good advice.
So these type of things, simple things, can help in controlling or managing those symptoms. But the most important thing, those patients who have low blood pressure, they must have a health assessment with their GP or healthcare professional to make sure that we can identify the cause and treat it accordingly.
Okay, thank you very much. Let's move on to hypertension now. We discussed hypotension, which is low blood pressure. We are moving to hypertension, which is high blood pressure. So what complications are associated with hypertension?
So hypertension is one of the, in the beginning of the talk we said, one of the 3 leading causes of causing health related issues. If you go from head to toe, hypertension can lead to several health issues. So if you starting from head, it can cause problems like stroke. In the old age, it can lead to something what we call dementia. And then below that, eyes. So it can affect the eyes, resulting in what we call as retinopathy, which is the effect on the back curtain of the eye. And that affects in the longer term your vision. And then below that comes the most vital organ is the heart. You can have problems like ischemic heart disease like angina, myocardial infarction, heart failure, sometimes rhythm problems of the heart. And then if you go down, you come across with kidneys. So it can cause problems like kidney failures. And it can also affect the blood vessels itself, causing narrowing of the blood vessels, what we call as in medical terminology as peripheral vascular disease. So,
we've done one of the episode on PVD in the past, intermittent claudication. So that was one of the related topic. So who is mainly affected by hypertension? Is a male, female, young or old, any particular group?
So if you talk about what we call as incidence or prevalence, as you can say, according to the guidelines and information available, says 1 in 3 in UK every third person in UK is affected by high blood pressure.
That's the bad news.
So overall prevalence is like in the world is every second person may have high blood pressure. So it's a very common problem. And it may be like the overall prevalence is more among males than females. Then there are other kind of category of patients who could be affected by the hypertension, or there are certain kind of factors which could lead to it. So like, for example, if you are overweight, then there is a high chance you may have blood pressure as well, or high blood pressure as one of the health issues. And then there are genetic factors. So very few cases where could be familial, what we call a familial in family reasons for you to have blood pressure. Then there are other things, for example, diabetes, kidney problems itself, blood vessel problems like narrowing of the blood vessels through genetic conditions. They can also cause high blood pressure. Then there are endocrine problems which can lead to the certain hormonal imbalances in the body. They can cause high blood pressure as well.
Okay. So what are the treatment options for hypertension? How can we treat it?
Hypertension, in order to deal with it, if you simply divide the approach into two things, there are certain things which we can do in order to lower or manage the blood pressure within the normal range without using medication. We call it a non-pharmacological approach. The other is medications, which we call pharmacological approach. The non-pharmacological approach mainly covers things like lifestyle. So one of the main reasons or risk factors for having high blood pressure could be the lifestyle, the modern days lazy lifestyle or stressed lifestyle could also be a contributing factor. So as they say, we say that 40 minutes of exercise at least 4 times a week or brisk walking can help you to reduce blood pressure. Reduced salt intake can also help you to reduce high blood pressure. Losing weight can also help you to reduce blood pressure. Healthy diet can also help you to reduce. More intake of fruits, vegetables can help you to reduce blood pressure. Smoking, avoiding smoking, cessation of smoking obviously can be a very good very good measure to reduce the blood pressure and also prevent the complication of blood pressure. Reduced alcohol intake or alcohol avoidance at all will also help you to reduce the blood pressure. So, and one of the things which from modern lifestyle is like high intake of caffeine or drinks containing caffeines, like Coke and energy drinks, things like that. They can also lead to high blood pressure. So addressing that issue can also help you to reduce it.
Okay. Do you know how old is this disease? Is it a kind of a result of the modern day lifestyle? Can we say that?
To some extent, you could say, as I kind of mentioned, that there are certain changes which modern day lifestyles have brought. Some of it is like, because it's more dynamic, we are more active, and there is stress levels are up. So high stress levels can also contribute to high blood pressure. Okay. In order to cope with that, some people use more caffeine, more tea, more caffeinated drinks. They can also affect the blood pressure. Alcohol intake, smoking, these are some things which are part and parcel of some of the modern day lifestyle. So addressing those can also help you to reduce blood pressure. Whether the disease is fully caused by these modern day factors, I think it is probably harsh to say. These are all contributing factors. Okay. There are other reasons why people can have high blood pressure, but these factors also contribute to causing the blood pressure to go on the higher side as well.
Okay. Because usually the diet and the lifestyle plays a bigger role in person's health and well-being. When in terms of hypertension, how big their role is. Do they have a smaller portion of it, or is it the major role? They play a big role. We can manage it, or they might be the reason the blood pressure actually started going up. What are your thoughts?
There might be a very contributing factor, good, strong reasons why the blood pressure going on the higher side. There are, as I said, there are other factors as well. Some maybe have a genetic predisposition. You may have underlying endocrine problems, or you may have underlying other health-related issues like kidney problems, through which you are prone to have a high blood pressure. But these lifestyles and dietary factors can make the blood pressure go further up, or may bring the disease to the surface. So these could be strong risk factors. In terms of there are studies which have been conducted to see what will be the impact of changing various types of factors in controlling blood pressure. And in some studies, in the most of the studies actually, they support the idea by changing lifestyle will help you to reduce the blood pressure. By changing diet will help you to reduce blood pressure. So as a simple example, I can give you, losing about 10 kilogram of weight can help you to reduce blood pressure by 5 to 20 milliliter of mercury. So there is a significant impact of changing these factors in controlling the blood pressure.
Okay. And the thing is, like in our modern day diet, there is a hidden salt in everything. We don't realize. The guideline says like 6 grams of salt every day, but we are taking too much salt. Starting from morning breakfast cereal, there's hidden sugars and salt in there. Kids are eating it. Then there are cheeses. In the cheese, there's a lot of salt in there. Then there's a bread, there's salt in there. So everything has salt, which people don't really realize. And they're taking too much salt every day. And that's obviously causing the problem of hypertension pandemic. Right, okay. So if we look at the pharmacological side of things, so which medication are kind of recommended to bring the hypertension down? And is these medication, do they totally eliminate the hypertension or just manage it?
So there are various types of medications available to control the blood pressure, and the emphasis should be on control. So this is disease, it's a chronic health issue. We can manage it by controlling it within normal range. So there are medications we can classify them into two groups: those which medication we use for patients less than 50 years of age, and those we use for the patients more than 50 years of age. Those medications for younger patients are mainly called ACE inhibitors, angiotensin receptor blockers, and beta blockers are commonly used for that group of patient. For more elderly and advanced age group of individuals, we use calcium channel blockers and diuretics. These are what we call as a first line group of medications. There are obviously side effects of all the different group of medications which can be used for high blood pressure, but overall benefit is greater than the side effects. So commonly used ACE inhibitors are like ramipril and lisinopril. They are very beneficial in not only managing the blood pressure, but also preventing the longer term implications or complication of blood pressure. So especially in diabetic patient, ACE inhibitors or angiotensin receptor blocker are very beneficial in preventing the cardiovascular and the kidney complications of hypertension. Common side effects of ACE inhibitor angiotensin receptor blockers is cough. So some patients may develop cough while using these medications, which can be managed either by reducing the dose or in some cases changing the medication to different types of medication. Another common complications which patients should be aware of using ACE inhibitor or angiotensin receptor blockers is they sometimes can develop swelling of their lips and face. We call it as angioedema. 10% of patients can develop. Again, by stopping these medications, this side effect can be controlled. And 1 in 100 patients can develop what we call as a kidney impairment as a result. So these medications can affect their kidney functions. That's why it's advised when you start patients on angiotensin receptor blockers or ACE inhibitors, they get a blood test done with their healthcare professional in 1 to 2 weeks, and then subsequently on different intervals to make sure their kidney functions are okay. Then the second group of medications, beta blocker, they're not very commonly used as an antihypertensive, but they are also helpful in managing the blood pressure. So they are more commonly used for the benefit of preventing heart-related complications, like angina, like myocardial infarctions, like rhythm problems due to high blood pressures. And one of the common side effect is in certain group of patients, like those who have history of asthma or heart respiratory problem like COPD, they can sometimes make it worse. But it's not very common nowadays because we have developed more selective group of beta blockers. They work particularly on the heart and the blood vessels rather than affecting the airway disease. And in some patients, they can reduce the heart rate, they can cause tiredness. Again, by changing the dose of the medication or changing to a different medication, you can manage these side effects.
You mentioned diuretics, in the list of the medications. So how do they affect on the body? Because diuretics, they can excrete a lot of fluid from the body, and then it can imbalance your electrolytes. If you are losing a lot of fluid from the body, your electrolytes level can go down. Do you reckon it can cause any problem?
So diuretics is a group of antihypertensive we commonly use for more of a advanced age patients, or more than 50 years of age to be specifically. Calcium channel blocker and diuretics. And the purpose of diuretic is, as you correctly mentioned, is to increase the urine output. And mainly they increase urine output and that as a result reduce the fluid level in the body, and that helps to manage the blood pressure. But as you pass more water through the urine, you can also lose electrolytes, and important ones are like sodium, potassium, and sometimes calcium and magnesium. It can also affect them. It is one of the side effects. The commonly used diuretics for these for the use for antihypertension are bendrofluozide. We commonly see that the electrolyte imbalance is a very common issue in group of patients using bendrofluozide as a antihypertensive. So again, it's a matter of monitoring the electrolytes at regular intervals and adjusting the dose.
So you adjust the dose. Do you prescribe electrolyte medication or anything like that to bring it up, or does the body manage itself over the time?
Usually the body what we call as homeostatic mechanisms or balance developing mechanisms will maintain it. But if it can become an issue, as I said, especially in elderly group. I have seen so many patients presenting to sometime emergency department, either with renal impairment or with the low sodium or low potassium as a result of diuretics treatment. So then we need to again consider whether this group of medication is helpful for this group of patients, or should we change it to a different group of medications in this cohort of patients. So I tend to change diuretics to either calcium channel blocker or ACE inhibitor, especially in elderly group patients where there are no other contraindications, to avoid causing these type of electrolyte imbalances, which can be sometimes serious because they can contribute to, as we said, electrolyte imbalance, which can cause a rhythm problem of the heart that can result in falls, syncopes, and low blood pressure due to loss of fluid from the body, again causing hypotension and falls as well.
So it can become a vicious cycle between hypotension and hypertension, unfortunately.
It can be, and especially elderly group of patients more than 65 years of age who may have other problems in addition to high blood pressure, like if they have diabetes, if they got Parkinson's, or if they got kidney problems. Diuretics can sometimes have these side effects. But again, the important thing is to that have a regular assessment of the patients with your healthcare professional, and then deciding is it the right group of right group of medication for this individual, or do we need to change it to a different group?
Okay. Some of the medications like contraceptive pills or over-the-counter medication people use, they can cause temporary hypertension in the person or the patient. Do you reckon they can cause permanent hypertension? And is there any advice, any guidelines, like people need to stop taking it, or is there any alternative to it?
Well, the contraceptive pills are known to contribute to high blood pressure. Okay. It's like one of the risk factors. There are certain things which we classify the risk factors into two things: what we can change, what we can't change. So modifiable and non-modifiable. So among the modifiable is those medications, over-the-counter medications, and including contraceptive pills. Obviously, there are certain group of pills they can cause more tendency to cause more blood pressure than the others. I think in that situation, I would advise to consult with your healthcare professionals before starting them, or come and monitor your blood pressure. And if you note that the blood pressure is going on the higher side, you may have to refer to a different method for contraception.
Yeah, unfortunately, some people are more prone to take medication for every small issue if they are experiencing if they have a small slightly pain in the body, they just run to a pharmacy and try to take medication. I think we should not encourage that type of behavior, unnecessary use of medication.
Like as you mentioned, some painkillers, especially the anti-inflammatories like ibuprofen, in some group of patients, they can contribute to cause either blood pressure or damage to the body, like especially if they have underlying kidney problem. So in those situations, anti-inflammatories like ibuprofen can worsen the kidney functions, which can increase the chances of having blood pressure and other complications.
Right. So as I asked that question under hypotension, if someone is experiencing an acute episode, what they need to do. Similarly, if someone suffers from hypertension, and if they have acute episode of hypertension, the blood pressure has gone really high, and they are feeling the effects of it, obviously they will be panicked. What do you suggest? What they need to do that can bring the blood pressure back to normal?
So unlike hypotension, which usually causes symptoms, the problem with hypertension is you may not have any symptoms, and then you are running the blood pressure very high. But some patients may have symptoms, as you mentioned. The common symptoms you can have is like headache, you may have vision problems, you may get angina pain, or you may start to have swelling of your legs due to effect on the heart and the kidneys. What you're talking about is something which very closer to my heart, because as an acute physician we deal with what we call as crisis. So that is called hypertensive emergencies, where the patients have a very high blood pressure, or urgencies where they have high blood pressure but the end organ damage is not there. But anyway, both situations are where we need to act quickly. So if the patient has got high headache, they have a visual symptoms, and they have heart pain or angina type of pain, they probably be advisable to check your blood pressure. The blood pressure 180 by 120 or more than that is considered a very high blood pressure, and it can cause healthcare issues, acute healthcare issues like bleeding into the head, bleeding into the eyes, angina, heart attacks, kidney problems. So in those situations, we need to act quickly and try to bring the blood pressure down. We may not have to bring it down quickly, but we need to bring it down into acceptable range over a period of maybe hours to days. But the important thing is, first, lifestyle changes, dietary changes, making sure you're taking your medications regularly. And when you have a blood pressure of 180 by 120 or higher than that and having symptoms, get the medical help, because we need to do some tests, including blood tests, ECGs, and then we have to give you medications in a different format and a different dose in order to bring your blood pressure down.
Okay. So, to sum up, what are your overall recommendations? One someone should do to prevent this disease, and if someone is already unfortunately suffering from it, what they need to do to improve their lifestyle?
So those, from prevention point of view, I think the more emphasis should be on prevention. And the prevention point of view, those things which we can change, one of them is our lifestyle, which we talked about in terms of activity levels. 40 minutes of brisk walking 4 times a week is a very useful way of managing and controlling your blood pressure. Secondly, some changes, important thing is changes in your diet, reduced and intake of salt within the recommended range, reduced intake of certain things which can make the blood pressure go high, like fats, or cause complication of high blood pressure. Fats, there are things like poultry, meat, fish, things like that, they can contribute to high blood pressure. Increased use of vegetable and fruits. And in terms of caffeinated drinks and caffeine intake, if we can cut down, that can help. Reducing the weight can also help you to manage the blood pressure. Similarly, smoking and alcohol, considering either, obviously, cessation would be ideal, but cutting down would be very helpful. Last thing is making sure, if you have blood pressure, make sure that you are taking the regular medication regularly, you're monitoring it, and you are consulting with your healthcare professional to make sure that those medications, either the dose is adjusted or their side effects are monitored and your blood pressure is responding.
Many thanks, Dr. Ilyas, for joining me today. I believe the information provided our viewers will find very useful. Many thanks for watching this episode. If you found this useful, you can share with your family and friends. And if you haven't already, make sure to subscribe to this channel. Thanks for watching.